Fambul una ado, mina Dr. Francis Wuri, Dr. Fodembele Umandem, and the Uman Siklem. We know say man and woman can meet and get in a relationship, they want forget picking, and ultimately they can find out say they're not able to forget belle or able to say they get belle and the belle they waste. Something that we call preconceptual counseling, we now basically the consultation with couples then forget with the doctor before they even plan for get pregnant. We can advise that this consultation happen at least 3 months before they plan them. Hence the reason why we always advocate that pregnancies are planned, even though we know say sometimes the mistakes then can happen. But inside this consultation here, so the goal now for let it be to say the one day we actually ready for picking, they're able to get pregnant and it's a healthy pregnancy. For let we also ensure say the mama and the picking safe, and also for reduce the risks that we can happen inside pregnancy as well. We go talk to the man, the woman, mostly with the woman, we want to know about in periods, ensuring say it get a regular periods, ensuring say it not get any offensive discharge, any history of infection, as this can don't lead to potential tube blockage. We want for CC then they get sex at the right time, because if you get sex at the time we already don't ovulate or past your ovulation date, the tendency or the likelihood of pregnancy it can be reduced. For demand, we want to know about any childhood diseases. Certain childhood diseases then they can affect in sperm production, the kind of work where they do, if they use a lot of heat down in private parts, all of them can affect sperm production as well. Camp family history, because certain things then we know say can affect people then born one. Let's say for example sugar sick we not control, or hypertension we not control. Some of them things then things then we can make either it difficult for get belle, or when you get belle you can get miscarriage, the pikin not can grow well, the pikin can die inside your belly, or by the time you born the pikin in size is small for the age where you don't born them. But instead they all a controllable. So now something we if we find out early enough, we able for make sure say you did on the right medication. So that say you get the belly now it controlled, and hopefully you will get a successful pregnancy. Mental illness now something again in families them we for be discussed, and now something we can be genetic and passed down from generation to generation. So if finally you know who that you did meet with before you even try to get the belly, finally you don't know what in your status in terms of sickle cell before you did meet with other person as well. Certain infections, hepatitis B, HIV, all of them things and then are things that we will need for know but before you begin plan a pregnancy. So we can discuss first of all medication, especially in HIV, for ensure say the virus not be transmitted to your baby as well. During this consultation, we also for talk about contraception, and all means to say because you did plan a pregnancy, you not on plan your life ahead, especially if it's not somebody where you intend for day with long term. It's very important that we able for discuss the kind, almost speaking, una go one forget the kind contraception or family planning methods we una go one for take. We also go discuss nutrition, whether right now you overweight or underweight. We go discuss accordingly. If you na person we overweight, you will find out go on a dietary regimen. We'll talk about exercise, lifestyle changes. If you're not person we underweight, how for increase you the kind of foods the way they eat, way for make sure so your body come up small, we can become likely for let you get pregnant. We'll talk if you dey smoke, if you dey drink, all of them things then they are things that we can affect you getting pregnant and you staying pregnant as well. If you dey take illicit drugs, then are like jamba or something like that, if I know we able for talk about that so that you able to stop, because that can make or affect how if you get pregnant and if you're able to maintain a pregnancy. If you don't ever do a cervical cancer screening or not, if I know we're able to do them. So if there's any issues, we're able to treat you now before you even get pregnant, because certain treatments will be not able to institute when there is a pregnancy. We will talk about medication. Any woman where they try for get pregnant, they finally they on folic acid, where they prevent certain issues there in the baby in early on. Because before you even do that first pregnancy test, so many changes to happen within that baby they as it grow. So if finally they on certain medications as well. A physical exam could be done. Obviously, check your blood pressure, check your weight, as we don't talk about. You know, check all parts of your body, your heart, your lungs, how do you man and get certain heart disease. We could make carrying a pregnancy. You know, we could advise against carrying a pregnancy, or even if you're able to carry a pregnancy, maybe the mode of delivery, how you deliver this baby, it could also different depending on the kind of condition where you get. Pelvic exam could be done for see if anything in your private area we go and bug you for get pregnant or able for carry a pregnancy, or also for discuss the mode of delivery when eventually you do get pregnant. Certain testing the way we could do, as we don't talk about genetics, certain genetic testing, certain infection screening, check for sickle cell, check your blood group. For the man we want to know about his semen, how his semen day in terms of his sperm count, in terms of how the sperm they move, in hormone levels, the woman as well in hormone levels. All of those things will be important as we try for plan a pregnancy. So this consultation here so not a way for the able to say you doctor able for help you for let una see waiting at the best way for able for plan a pregnancy, ensuring that mama and pikin safe. So another thing is something we want to frown upon, and that's something we will make a bit more common in this part of the world, as opposed to just seeing somebody where you don't get pregnant. Remember, say a healthy pregnancy they start even before the first positive pregnancy test. So till next time, Dr. Francis, we really wish you all a happy and a healthy week ahead.